We are going to speak about smouldering myeloma, and I will focus on the fact that it's very important to perform a correct diagnosis following the new International Myeloma Working Group criteria. So when you have suspected smouldering myeloma, you have to look very carefully at the eventual skeletal disease with novel imaging techniques. So I will focus on the fact that it's very important to use novel imaging techniques and not whole body X-ray. Then it's important to look at the bone marrow, so to look at the percentage of plasma cells in the bone marrow, and also in the laboratory test to pay attention to both serum-free light chain and proteinuria. So when you have looked to all these parameters, then you can have a correct diagnosis and you are not risking to misdiagnose an active myeloma with a smouldering myeloma. Then you have to follow up the patient, and you have to be aware of the fact that patients are at different risk of progression. So you have to establish the risk of each patient and to decide the follow-up, how frequently to perform the follow-up. There are several risk factors, the quantity of M component, the presence of a proteinuria. That's why it's very important also to check the presence or not of proteinuria, the eventual presence of cytogenetic abnormalities. The doubling time of the M component is a very important factor as well. You can eventually look by PET-CT to the presence of a focal lesion without osteolytic lesions. So all these factors, if they are present and positive, are putting the patient at higher risk of progression. That's what I was telling about, as it is an asymptomatic disease, and some patients can have a prognosis similar to the people having MGUS. You have really to be careful in not mistaking the diagnosis. So in this kind of patient, it's very, very important the diagnostic workup at the beginning. Once you have done this, you can be rather confident even to follow the patient like an MGUS, or to put the patient in, for example, a clinical trial of treatment, or to start to treat as an active patient.